Hello and welcome back to my channel. Today we're going to be doing arterial blood gas analysis. We're going to be first discussing partial pressures and what exactly that is, how to read a blood gas analysis and what you can do about it. What is partial pressure? So partial pressure is how much of that one molecule there is in a substance. So the partial pressure of oxygen in air is 0.21 kPa. What that means is that when we look at, for instance, blood, we can assess the partial pressure of oxygen or the partial pressure of carbon dioxide, which is how much of that molecule is in the blood. The next thing is acid-base balance. All right, so your body balances your pH by breathing faster, breathing slower, by releasing bicarb, or by excreting your hydrogen through your urine. So that's kind of how your body balances things. And so when you're looking at a blood gas, you must realize that when there is something wrong, either you have a metabolic acidosis or a respiratory acidosis, your body tries to compensate with the other. So a blood gas analysis is when you draw some blood from the artery, sometimes a vein, but an artery is better, and you assess all of these parameters. The four things we're going to look at is pH, PaO2, PaCO2, and bicarb, which is HCO-. What these things are is that they help us to assess whether we have a metabolic or a respiratory acidosis or alkalosis. So the normal pH is 7.35 to 7.45. If it's higher than that, you have alkalosis. If it's lower than that, you have an acidosis. Your PaO2, which is your partial pressure of arterial oxygen, which must be between 75 and 100 millimeters of mercury, or you have PaCO2, which is your partial pressure of arterial CO2, your carbon dioxide, which is between 35 and 45 millimeters of mercury, and your bicarb is between 22 and 27, and that would be your normal bicarb. If it's higher or lower, it's out of that range. So if we look at an acronym called ROME, so R-O-M-E, so RO stands for respiratory opposite, metabolic equal. So respiratory opposite means that if you have a low pH, so 7.3, we have an acidosis, and your PaCO2 is high, they have moved in opposite directions. Your pH is low, but your CO2 is high, so respiratory opposite, you have a respiratory acidosis. The same is true if your pH went up and your PaCO2 came down, you have a respiratory alkalosis. So then you have metabolic equal, the other part of ROME, which means that if your pH drops below 7.35, you have an acidosis. But if your bicarb drops at the same level, so they're both low, your bicarb is less than 22, you have a metabolic acidosis. And if your pH is above 7.45 and your bicarb is above 27, you have a metabolic alkalosis. So those are ways to assess whether you have a metabolic or respiratory alkalosis or acidosis. And what this means is that we are able to diagnose a patient better. If they have a metabolic acidosis, it could be due to a diabetic ketoacidosis. If they have a respiratory acidosis, it could be due to asthma or COPD or some sort of respiratory illness. Maybe your ventilator settings need to change. So what can we do about this? Well, if the patient is not ventilating well, you're able to tell. If they're not oxygenating well, you're also able to tell, because if their PaCO2 is normal, but their Pa2 is low, it means that they're ventilating, but they're not oxygenating. If they have really good PaO2, so they have a PaO2 of 100, and they have a very high PaCO2, it means that they're oxygenating well, but they're not ventilating well. Those are the kind of things you're able to tell, as well as you can do something about this. So if you ventilate a patient faster, you lower their pH. So for every 1 millimeter of mercury above 40 in your PaCO2, you change your pH by 0.008. So if we increase our PaCO2 or decrease our PaCO2, we move our pH in the opposite direction. So if we decrease our PaCO2 by 20, we increase our pH by 0.15. So if they have a pH of 7, which is deadly, and we ventilate them twice as fast, we'll bring their pH from 7 to 7.15, which is not much of a difference. Remember to always look at the pH. If it's high or low, then you look at your PCO2 and your bicarb and see whether they've moved together or moved separately. They can both move together at the same time, so you can have a combined metabolic and respiratory acidosis. And what you can also see is that if the body has already started to compensate, if you have a metabolic acidosis, you will see your respiratory move in the opposite direction because your body is trying to compensate for those changes. Hope this was helpful and informative. If you enjoyed it, please hit the like button and subscribe, and we'll see you in the next video.